Welcome, everybody. Welcome here to the Facebook page. We have some exciting news. I'm going to just direct it right over to Dr. Shelley Cole. Shelley, take it away.
Thank you very much. I just want to welcome you all to our very first show. We're so excited. Matt Betros, my co-host here, and I have been doing a show for many years. Actually, I went back, it's over 5 years.
5 years, yeah. Over 5 years, that's right.
5 years. And so this is a little bit of a twist on what we've been doing for a long, long time.
I don't know. Is it? It's just more refined.
I hope it is. I don't know. But it's my passion is educating people about medicine and how they can use natural things to fix problems that they have when they go to the doctor's office.
Okay, but they're missing the exciting part.
Yes, that's true. That's true.
First of all, after this Saturday will be the third Saturday of the month, and Dr. Shelley will be on my show, the Aaron's High Cap Adventure Radio program on KMIL 105.1 Sheer FM. She'll be on there like she is every Saturday, every third Saturday to talk. But this is different. So tell what's going on.
So we are starting a show, and this will be the first episode of our new show. It's called Do No Harm with Dr. Shelley Cole.
What a great title. Do No Harm.
You know, people come up to me all of the time and say that. They're frustrated because they say, you know, I went in to the doctor and they took the Hippocratic Oath and they're supposed to do no harm. And I'd say that's absolutely right. And so above everything, the doctor's supposed to do no harm. So our show is called Do No Harm.
Sometimes it's a Hippocratic Oath.
Maybe so.
They're supposed to do this and they do another. But
right. So the show is called Do No Harm with Dr. Shelley Cole, and we'll be on at Wednesdays at 10 a.m. Every Wednesday. And I think it's so important to do this work because we can help more people doing this.
We'll give them the call letters of where you're going to be.
Yes. Well, it'll be ktcp.org. It'll be live streamed on the 22nd of October, and then we're going to go live on the radio, 98.7 FM.
And we'll post that. We'll make sure you're all aware of it. So she's going to be doing a new show, Do No Harm, and it's going to be every Wednesday from 10 to 11. And the call letters again?
ktcp.org. You can live stream it, or you can listen on the radio. On the 29th, it'll be on the radio, 98.7.
Fantastic.
Yeah.
And so for your opening show, you're going to hit what?
Well, I have a question for you, Matt.
Uh-oh, what?
So, have you ever been late for your doctor appointment?
No, they've been late coming to see me.
Sorry. Well, I can believe that. So, but let's say there's a little bit of traffic outside, you're a little rushed, you run into the appointment, right? They call you back immediately. That would be fun, wouldn't it?
You mean when I've been rested and calm?
Right.
Okay.
And they slap on the blood pressure cuff and immediately take your blood pressure.
Dr. Shelley, I cannot remember. I don't think I can remember any time that wasn't the case, where I'm rushed in and they don't give you time to settle in and your blood pressure is read inappropriately.
So it could be high.
Yeah.
I mean,
But in reality, it's not. But you're running around and they're testing it.
Right. And so blood pressure does go up, right? When you're rushing and you're stressed, your blood pressure will go up. But the frustration is that they immediately say your blood pressure is high. We need to get you on a blood pressure medicine, right? That's oftentimes the case. So back in 2017, they redefined high blood pressure guidelines, and they said normal is anything less than 120/80. Okay. Now, before that, we were more concerned about the threshold of 140/90. But now, by definition, if you have a blood pressure of 140/90, you do have hypertension, but they're treating people earlier. So if your blood pressure is 130, or if it's 120 over 80 and you have other circumstances going on, sometimes the doctor will put you on blood pressure medicines.
Am I getting ahead of you if I say this, where the older you get, the harder your veins are, and it puts more pressure where the numbers would be higher, isn't that right? Whereas
Well,
when you're
that's
younger,
true.
they're
That's
flexible.
true. I mean, we don't have the same blood pressure at 75 that we had at 20, right? That's very true. The blood vessels are very different. The body has been through many toils and pressures by that time, and typically the blood vessels get more stiff and rigid over time. And today we're going to talk about nitric oxide and its role in that. And then we're also going to be talking about one of the strategies that you can use to lower your blood pressure naturally. So I'm really excited about that. So we're going to cover, this week we're going to cover nitric oxide and red light therapy. And then next week I'd like to cover voltage therapy that we offer in the office and then ozone.
Since you're talking about blood pressure, though, with what you just said about the 120 mark, and then we just mentioned how you get older and sometimes it's going to be higher.
Right.
And then they throw you in the office and you're racing around when you get your blood pressure check. There's all these factors, and there's a potential, I think, for giving wrong diagnosis. You would think they'd give it like the best 2 out of 3, or calm you down, or understand that the older you get, the harder your arteries get and more pressure is put on it, and have to calculate that in, right?
Well, you're absolutely right. I mean, just think about the devices. I mean, we used to do a manual blood pressure. The nursing assistant would listen, and we would use a manual and listen to the blood pressure. Now there are digital devices that we use that are automatic, and so they are typically not consistent. And then, of course, there's white coat syndrome, right? You know, that's why I don't wear a white coat. At the Mayo Clinic, we did not wear white coats specifically for that reason, because people would get more uptight and nervous when they would go into the doctor's office. So white coat syndrome is real. It can account for about 10 to 15 millimeters of mercury increase in your blood pressure just because, gosh, you know, I'm in the doctor's office. And then the thought, oh my gosh, well, what if my blood pressure is high enough that now they're telling me I need a blood pressure medicine?
See a doctor in a white lab coat, and I can picture the blue gloves in the pocket and the rectal thermometer. I'm just thinking, stress.
Well, yeah, that'll definitely stress you out. Yeah, no kidding. So there are many facets to blood pressure, and then of course the devices at home could be inaccurate as well. So we often ask patients to bring their device with them so that we can kind of see if it actually is kind of in an accurate range, because most of the time, I will say, they're elevated. They're 15 to 20 millimeters higher than what we get in the office. I mean, just the size of the cuff makes a difference. But you do have to sit. You do have to relax. In the past, we used to say the patient needed to sit on 2 separate occasions, so 2 doctor appointments. They'd have to sit for 20 minutes, calm down, right? And then somebody would take their blood pressure. And if it was elevated, then yes, we could say that is an elevated blood pressure. But we don't do that enough. We don't take enough care with that.
Shelley, we got people asking, can you repeat the call letters for the station so they can...
KTCP.org is the website. It's a live stream. KTCP.org. And the FM station is going to be 98.7 FM. So we're excited about it. So this is a community radio station that everyone should be involved in. And so we're very excited about it.
Very good.
So,
all right, so we're here at the blood pressure, and where are we going to go from here?
Well, I want to give them kind of a little story and tell about a patient that we had. She's given me permission to talk about her, and it's kind of an interesting story because it's been a journey. She was on 5 blood pressure medicines, if you can imagine.
No, I can't. I believe it.
Yeah.
But it's like, why?
She started on blood pressure medicines 40 years ago. And they just kept adding them and adding them. And by the time she came in, she was on 5, which is a lot.
I don't understand, though, 5 different blood pressure meds. They give her one and she jumped. They gave her one that went down. They gave her one that popped her back up. I mean, what's going on?
Right. So anytime the body has something come in, it adapts to it, correct? Mm-hmm. So if you're on a diuretic like hydrochlorothiazide, then that makes you urinate out fluid from the bloodstream, so it shrinks the blood volume, okay? Makes the blood thicker. There's less blood to get through the blood vessels, so the blood pressure drops, okay? And so you're urinating out more, but you're really not fixing the cause. And so I guess what I would try to say is, if you go into the doc and they say your blood pressure's high, you need to go on a blood pressure medicine. We used to say, well, diet and exercise, right? Mm-hmm. We always used to say that for almost everything. You know, your cholesterol's high, diet and exercise.
That's just a good thing to do.
Well, it is. It is. Nutrition and exercise is always a wise thing to do, and it does make an impact. But if you're on a blood pressure medicine, then, there are consequences to it. The body adapts to that. And so she came in and she said, I want to get off these. And I said, okay. Now, it's going to be a journey. It's not going to be overnight. We don't want to do anything that's going to jeopardize her, health in any way. So we want to lower the blood pressure slowly and taper her off these meds as we did it. And it took about 6 months to do it. And so that's what I want to share today is how we helped her get off her blood pressure medicines safely. I'm not saying just yank them. And sometimes we do have people come in and they go, I just hate these meds, I want to stop them. And they stop them, and of course their blood pressure skyrockets, and that's not smart either.
Well, if you're not going to correct what the problem is, and you're masking it with the medicine, if you don't come up with a plan to fix it and take off the medicine, then you're gonna crash and burn because you didn't have a secondary plan for healing, right?
We want to address the reason why the blood pressure went up in the first place.
That's right.
Right? And so I don't really look at blood pressure as a disease. I look at it more as a symptom. Why is it going up in the context of everything else? We know that it can cause increased risk for heart disease and strokes, and so we don't want to have high blood pressure. But why is it going up, and why don't we fix the cause of the high blood pressure instead of just lowering it and really not getting at the core disease? Because we don't want the heart to need the blood pressure. We want it to drop, and so the heart goes, well, thank you. I didn't want to be pumping that hard to begin with in the first place, right? So, and that's what we like to see. And I do remember one gentleman who started our program, and it was about 2.5 weeks into the program, and he came into class because we have a class, and so he came into class, and he says, the ladies up front tell me that I'm supposed to tell you my blood pressure's too low. And I said, well, doggone it, looks like you're going to have to get off that blood pressure medicine, So if we can really address the cause instead of treating the symptom, we're going to be far better off. And then you don't need the blood pressure medicine.
The patient that you had that got off these blood pressure meds, was there a different type of feeling that she was having after she
would get off of them? Yes, and that was a very interesting thing. So what we first address when in my practice is when somebody has pain, their blood pressure is going to go up.
I can see that.
Does that make sense? It's just inevitable that it's going to happen. And so you must address pain. If you ignore pain, they're going to still, the stress hormones go up, inflammation goes up.
You know how much I've got.
Yeah, yeah.
But my blood pressure is tracked steady for years. What would be an explanation for that?
Well, because you've tackled the issue with all the pieces of the puzzle. You try to eat well, you move your body, you keep muscle tone, so you're doing the important pieces of the puzzle.
Not just sitting there.
Right.
Okay.
Because if you just sat there, then it would be a lot worse.
Mm-hmm. Tell you what, the last 2 weeks, it's been rough.
Has it?
It's been hurting a lot.
Well, I wonder what your blood pressure is.
It'd be interesting, because I didn't even think about that, but I know the last 2 weeks, it's like I'm dragging 5-pound weights off my wrist and my ankles. It just wears you out. And I can see how that would increase blood pressure.
Yeah, yeah. So with this patient, the first thing we did was we treated her pain. Now, she had a condition in her neck and in the lower part of the back of her head that was very unusual. And so we treated it with ozone treatments. And we're going to talk more about ozone next week. But ozone is an anti-inflammatory, so it lowers the inflammation. She had cervical stenosis, which means that there's a limit in the space there. So, of course, any kind of swelling is exacerbated. Oh my goodness, it's 2 or 3 times as bad, unless if you had the normal space that you would. So she had pain. So we addressed the pain, tried to get the inflammation down, and so the pain improved. Then she was able to sleep. So sleep was super important too. Like if you're waking up in the middle of the night just because you roll over on one side.
That's me all the time.
Really?
So when you were saying that she's getting sleep now, I go, oh, that's going to be dramatic.
It is dramatic because, when you wake up, it's like, and the steroids, cortisol goes up, the stress hormones go up, inflammation goes up. You're not getting that wonderful, restful sleep that you need. And it's a nightmare. So now she was able to sleep. And then her cortisol started to drop. So we were able to drop a medication,
Mm-hmm.
And so then it was interesting because I asked her, she goes, oh, I feel better. I said, well, what does that mean? Like, in what way do you feel better? Sometimes people will say, I have more energy. And I think she just said, I just feel more alert.
Well, that's kind of the same thing, more energy alert. And I would
Yes.
think that would be the immediate reaction. If something's weighing you down or something's affecting your body and it's eliminated from the body, your body's going to do what it's supposed to be doing, and that's be moving, energetic.
Exactly. So we got her off of medicine, and that was wonderful. And her blood pressure did stay stable. Now, sometimes the meds do make it actually be more labile, up and down. And so it's kind of a crazy journey. But one of the things that we also did with her was the dentistry. So she did see a biological dentist, and we'll have more shows on biological dentistry in the future. But she went to the biological dentist. Her pain complex appeared worse when she would chew. It's just kind of an odd thing. So I knew that it had to do with the jaw in some fashion, and so I sent her to the biological dentist. It helped, but to truly resolve the pain, we had to use ozone therapy. And so pain, the problem is if you are in pain, it's going to be really hard to lower your blood pressure. because your body thinks of it as a message. It's a message to do something, to fix something, to go somewhere, to run away from the bear. So all of the stress hormones kick in and try to fix the problem, right? Which is often man-made. So anyway, so she did get better. We got off some of the meds, and then we started using something called nitric oxide. And so nitric oxide is something that you naturally make in your body, okay? We get a lot of it when we're young. So in our 20s, we make a lot of nitric oxide. By age 65, most of us are making about 15%.
What's making this? What is it? What does it do?
So it helps relax the blood vessel, and which opens up the blood vessel, so the smooth muscle in the blood vessel relax, the blood vessel dilates and opens up in such a profound way. To look at the blood vessels on nitric oxide versus without nitric oxide, it's a dramatic difference, because if you increase the diameter of a blood vessel by 13%, that increases flow anywhere from 34 to 40% more.
Wow.
Okay? Just a little bit wider blood vessel, you're going to get a lot more blood. And so the body needs that oxygen to go to the cell. And that's extremely important, because that's where we make energy, at the cell. And so if you can't get the oxygen that you breathe in and get it to the cell efficiently, then you're not going to make enough ATP, and that's the energy currency of the body.
I don't want to mess you up here, but I got a question. You're breathing in the air.
You can interrupt anytime you want.
You're breathing in the air, it goes into your lungs.
Right.
It dissipates through the capillaries and all that kind of stuff and goes into your bloodstream. How is that oxygen, clarify, how is that oxygen that's so important to the cells getting in there, into the cells?
So, into the cell, well, okay, the hemoglobin, the red blood cell, is made up of hemoglobin, okay? And hemoglobin holds the oxygen and carries it through the blood vessels and gets it all the way through arteries, arterioles, capillary cell, right down to the cellular level. And then depending on the pH in the body, if you're highly acidic, the body doesn't really like that.
I'm understanding you with the arteries and all that. It's like a pipeline. Big pipe, small pipe, goes all the way down to the cell. How does it get into the cell?
How does it get carried into the cell?
Am I messing you up here?
Well, I mean, that's a question. I mean, the complexity, all of the different steps, I really don't know if I want to go into it, but I would like to explain how you need oxygen, because we all need oxygen. And so if it's not working right, then it's not getting to that mitochondria, the energy organelle of the body. That's where we make our energy. And the energy is what's important. If you have energy, you can make a muscle. You can clean up toxins out of the body. You can build tissue. You can run away from the bear. You can think logically. But if you don't have energy, you have brain fog. You don't want to do anything. You want to sit in a chair. I just don't feel like doing anything today. So oxygen is the final step.
I say that every day. It's the mental discipline that gets me going.
Well, that's good. See, and you have that mental discipline, Matt, and that's why, your blood pressure is okay, because I think you're kind of juggling all these variables and really, you don't give up. You don't quit.
I didn't mean to interrupt. Keep going.
No. So the oxygen is the very last step in a long sequence of events to make energy. Okay? And so if you can't get the oxygen there, you're not going to make the big payoff of 36 ATP, which is the energy that we need to function. You're only going to make 1 or 2 ATP here and there, and we need ATP. In fact, our body needs about our body weight of ATP every day, if you can imagine. We need to make a lot of ATP. But if we don't, let's say that it even drops by 5 or 10%, that is a huge consequence to us, because there's maintenance and repair. You know, like, oh my goodness, what if you want to make a brand new cell? That takes a lot of energy, you know. And so oxygen is foundational. And so if you don't have the oxygen, you're not going to make the energy. And so what do you think the heart does when oxygen levels drop at the cell? The heart rate goes up. It's like, quick, get more oxygen.
Okay, yeah.
Get more oxygen to the cell. Hurry. And what do you think happens to blood pressure?
Goes up.
It goes up. And so then you go into the doc and they say, well, your blood pressure is high. Let's put you on a blood pressure medicine, right? And so without really the consideration of how did it happen? Now, wonderful doctors there are, yes, but they kind of don't discuss all of those issues. It's the medication, you know. We'll put you on a medicine to get your blood pressure low. That's the common answer.
Does any of this affect or cause palpitations?
Well, if your heart rate is too fast and you don't have enough oxygen, what if you are anemic and you can't carry oxygen to the cell? You don't have enough red blood cells. Then the heart can, you know, try to pump faster, but it can't pump as fast as it needs to, so it can cause an arrhythmia. So all of those factors are super important, and one of them, that nitric oxide, that discovery about 25 years ago was one of the most profound discoveries in cardiovascular health known to date. 3 Nobel laureates received the Nobel Peace Prize in 1998 for the discovery of nitric oxide. And what they found was that the plaque in the coronary artery correlates to the drop in nitric oxide. So in our 20s, like I said, we have a lot, but by age 65, we only have 15% of what we used to have, and the plaque gets larger and larger and larger. So that relaxation and smooth muscle dilatation of the vessel is really important. The other thing it does is it prevents the platelets from sticking to the sidewall of the vessel. So the white blood cells and the platelets are less sticky, and so less chance for a plaque to form. And so the white blood cells go to where they need to go to. You don't get plaque formation. And of course, plaque formation obstructs flow in the vessels too. So nitric oxide is really important. And so we naturally make it. There's some foods that you can eat to stimulate production of nitric oxide. And spinach is one of them. I didn't know if Popeye knew about nitric oxide or not, but
Get my, what is that, corn cob pipe ready?
right. Let's see, what else? Arugula, beets. So all of those products that you see online, the beet products, they have to do with the production of nitric oxide. So yes, we want to stimulate the production naturally of nitric oxide. And a couple of things that I would also say about that is it's important not to use caustic mouthwashes in your mouth because you're killing all the natural bacteria in the mouth.
Okay, so how do you get around that when people want to stay fresh and all that kind of stuff?
So you can...
Eat an apple?
What? Eat an apple?
Eat an apple? Would that help them?
I don't know if an apple helps with your bad breath. But, scrubbing the tongue, so using, fluoride-free toothpaste, scrub the tongue. That's fine to do. Keep the bacteria natural in the mouth. Don't use caustic kinds of mouthwash. Does that make sense?
Sure.
The other thing is you have to have enough acid in your stomach to produce nitric oxide. So these medications called omeprazole, the PPI inhibitors, Nexium, Prilosec, Pepcid, these medicines lower the acid production in the stomach, which will lower, the nitric oxide in the body. So super important. Nitric oxide also acts as a neurotransmitter, so it keeps the nervous system healthy. It's just amazing at all of the things. It helps the muscles. It keeps them young and strong. It brings more blood to the muscles. The immune system, it's antimicrobial, so they're antibacterial and antiviral. So nitric oxide, it's hard to believe that this, what we naturally make is antibacterial. Mm-hmm. But over our lifetime, we lose that ability to produce it, and then we are dealing with a lot more inflammation.
Shelley, if we go back to our critical date of 1950 that we always talk about.
Right.
And you're a doctor, and you got a patient before all this medical stuff, like from the pharmaceutical companies. The doctor would say, well, your blood pressure's a little high, and there would be a list of things that you could do. Can't we get back to that with the doctors and all that?
Well, it would be great. The problem is that we are exposed to so many more toxins in our environment, and toxins are burdening our body. So when you have a body burden of toxins, your inflammation goes up. So the inflammatory system is supposed to modulate. It's supposed to go up when you have an acute infection, and then it's abruptly supposed to go down. But people are living in pain and chronic inflammation. And so it's the swelling and the inflammation of the blood vessel that really makes it more difficult for the heart to pump blood through the vessel to get that oxygen to the cell. That's what the body wants, is how do I get that oxygen to the cell? And so if we can lower that inflammation at the blood vessel, and that's what the gentleman, after about 2 weeks on the program, that's what happened to him. His inflammation dropped, and guess what? The blood vessel opened up, the blood got to the cell, and now the heart doesn't have to work as hard, so the blood pressure drops. And the heart says, thank you very much. Because
how quickly do you think you'll notice on people the change if they do things like this?
Well, another thing I want to talk about today is red light therapy, and we'll do a blood pressure before they go in to the red light room, and then we'll do it when they come out 20 minutes later. And it can drop anywhere from 10 to 20 points, we see their blood pressure drop because of red light therapy. So your body will respond to these natural, nitric oxide. It will be an immediate effect. We have a professional line of nitric oxide that we use for our patients. And I've had people in hypertensive crisis, and they do just fine with nitric oxide.
Shelley, not to be funny, but if I got a white light with a lens, and got a red magic marker and put it on the lens, we're not talking the same type of red light therapy, right? Is there special type of lights?
Well, so they're wavelengths. You've got the near infrared, and you've got the spectrum of light. Some you are not visible, some are visible.
So it's like you got a light board, it's got all these different frequencies, is that what you're saying?
Yes. So the wavelengths. And so our red light panels have a little bit of blue in there, blue light, to stimulate circadian rhythms, to help people wake up in the morning. It's that blue light.
That's interesting because, as a shooter, and I use a red dot or a green dot,
right?
My eye picks up the green dot much quicker because I guess the body it picks up green better than it does red.
Yes.
So when you're saying, I'm not putting down red therapy, I'm saying lights. It's weird. I'm coming to learn this.
Your body responds differently to
different
absolutely. So the nitric oxide is great for wound healing, making new red blood vessels. It also helps the placenta. So during pregnancy, it helps perfusion to the baby. It helps with fertility. It helps the lungs oxygenate more, so improves circulation. So lowers your blood pressure. And so there are studies using nitric oxide to help lower the blood pressure. And really, you would think after 25 years, we would be using it every single day in the practice of medicine. That's my hope, that we will. So nitric oxide's super important. And then I wanted to go into a little bit of detail on red light therapy. And so her blood pressure would drop 10 to 20 points just going in the red light room. And so why? Why does that happen? So there is, just like with plants make energy out of sun, photosynthesis. We make energy out of light too. There are photosensitive cells, one called the cytochrome C oxidase. It's an enzyme, and it's actually an integral part. It's a protein that's in the cell membrane, in membranes, so it can be in the mitochondrial membranes too. But these are sensitive to light, so they're stimulated by light. And so what happens is it stimulates cytochrome C to get the oxygen to the final steps in energy production, and that's where you can make more energy. So red light itself helps us make more energy. It also helps us release that nitric oxide more readily from the blood vessels. So it stimulates the production of energy. It stimulates the release of nitric oxide, which we just talked about being that benefit of opening up the blood vessel, dilating the blood vessel, relaxing the smooth muscle, the antimicrobial benefits, the anti-clotting principles as well, just are really profound.
So when I'm standing in my newly renovated shower, beautiful shower.
Oh, wow.
And I've got the light selection of red, green, and blue above me.
Right.
And I've got my teak stool that if I want to sit down and chill in my rain shower.
Oh, my
and I just want to
gosh.
relax. What color should I have? I should probably have red,
I would
not
probably
blue.
have red.
Because blue is...
Yes. So, blue light, now, the issues with blue light is in the middle of the night when somebody's on their cell phone and they're getting blue light straight into their brain, and it shuts off melatonin production and says, wake up, it's morning. That's what blue light does for us. So we're, so you're in the middle of the night and you can't go to sleep because you're wide awake.
So in the morning, blue.
And
go
then
to bed, red. Bed red?
Yes, bed red. Yeah. So, and I have a red light panel in my room, and you know what?
You're going to put it in the shower now.
I'll put it in the shower. No, I have to plug it in. That would not be a smart thing to do. But the dog always comes in every single time. It's like, I want to come in there, so the dog always comes into the room. The animals know these things, they definitely know.
When you're doing that, are you doing it, is your eyes taking it in, or are you undressed where the skin is taking it in?
So it is the skin. I mean, the more skin you can expose to it, the better. we've known for a long, long time the benefits of wound healing and collagen production, hair growth with red light therapy. And so wrinkles, those kinds of things are treated with red light therapy. But it really was when I started learning about the benefits to dementia and neurodegenerative disease and energy production that really kind of caught my eye, and I said, this is something we need to be doing. I didn't appreciate initially the benefits to blood pressure, but I could really see, wow, this is anti-inflammatory. It's lowering the blood pressure naturally. It's relaxing that smooth muscle. It's improving what we call the autonomic nervous system, the balance between sympathetic and parasympathetic. We've talked about the vagus nerve in the past, and I'm sure we'll talk about it again. That rest, repair, and maintenance component of the body versus stomping out fires. You're in crisis mode. So your body needs to be able to balance between those two. So red light therapy is incredible for that as well. So,
at one time, some time ago, I was looking through a catalog, and they had this hat you put on with all the red lights. It was showing an individual who didn't have much hair.
Oh, yeah.
And I'm thinking, what is this crap, What the heck's going on? And as I learn more, I'm going, wait a minute, maybe there's something to it.
Maybe there is a benefit.
But you got to make sure that they're just not red LEDs. They got basic wavelengths.
Right. It needs to have the actual red light therapy. Well, I saw a picture of somebody with a red light mask on, and she was sitting outside, but it was just the most beautiful, mountain scenery. And I thought, oh gosh, couldn't you just be enjoying the normal light outside? You're getting some photosensitive.
Getting some vitamin D.
That's right. So it's super important if you want to know, your doctor can test you. We have little nitric oxide strips to test people for how much nitric oxide that they're making. But celery, arugula, spinach, and the beetroots. So that's why those products, the little purple beet gummies, are so popular.
Didn't know that. I like beets.
Yeah, beets are wonderful.
Make a salad with a little bit of onion in there, dress it up, get your vinegar in there, your apple cider
vinegar, and then throw some arugula on there. Yeah. Right? You're set.
If I knew what it was.
Well, it's part of it's a lettuce.
Okay.
It's like a lettuce kind of thing. Yeah. So red light is great. It's wonderful for wound healing, which is super important. So we'll put people in the red light room for, they may have diabetes and something's just not healing.
Didn't you have a red light band?
We have a red light band, and methylene blue, which we've talked about in the past, and I'm sure we'll talk about again. Methylene blue is potentiated by red light therapy. So now, we take and this morning I took my methylene blue and I put my little red light band on. If you put it on the wrist, it is right there by the radial artery, and so it'll activate the blood that's going by the radial artery.
Very interesting.
So that it can lower your blood pressure naturally, which is great. So red light therapy would be great. Ideally, it would be good if somebody could do it 3 to 5 times a week for 20 minutes. No more than 20 minutes a day. That's it. I think it's good because I always think about calming and relaxing in front of the red light. I like to do my little tree pose. I try to do a little bit of yoga, trying to think of...
if I did yoga, I'd break. I'd hurt myself or something.
Right? But it helps with balance. Oh, my gosh. And as we get older, balance becomes even more important and being able to get up off the ground is super important. So working on your strength and balance is important.
Now, I want to remind people that next Wednesday.
Yes, well, this is our first show. We're recording it now, and on ktcp.org you can stream the show.
And that's 98.7?
98.7 FM. Yeah.
So spread the word on that. And then don't forget also, Dr. Shelley is on my show, the Aaron's High Cap Adventure Radio program, every third Saturday of the month. And you can check her out live right here on Facebook when we do it.
Right. So if I were a patient and I had high blood pressure, the first thing I would do is take my device into the doctor's office, make sure your device is accurate. Okay? You don't want to be flipping out thinking, oh my gosh, I'm in hypertensive crisis when it's an inaccurate reading, right?
Can you do it yourself? Can you give yourself one without machines?
You mean check your blood pressure? Some docs can do it. Most cardiologists can, feel the radio.
You yourself, the person before they go in, can they get an idea so that when they go in there, they can see if it's somewhat close to what the machine is saying?
I don't know anyone who can, check their blood pressure on their own without a device. Is that what you're saying?
Well, how would they do it before we had devices? You had your stethoscope and
the stethoscope. You had to manually put that blood pressure cuff on.
So that's the only way you can check blood pressure is by the cuff.
Well, there are some cardiologists that can, take the pressure off the finger, and they have such clinical skill that they can tell what your blood pressure is.
That then, yeah.
But not the normal person, not most people. So just checking the blood pressure and making sure it's an accurate number. And then always, the first thing, if somebody is saying, we need to get your blood pressure right now, just say, I really do need to sit for a minute first. I just rushed in. Can I please sit for a minute?
That's very important, because if you don't, they're going to diagnose a wrong blood pressure and give you medicines when in reality you didn't need it. It's like
it really wasn't high blood pressure. It was a normal blood pressure.
It was like when I was talking about how they weigh me with my boots on and my clothes on, and they write that number down, and I'm thinking, well, wait a minute, let's say my height and now my weight doesn't match my height because I got 20 pounds of clothes and equipment on me. And they're going to diagnose me wrong. Same thing with the blood pressure.
They're going to tell you you're obese, but you're wearing 16 pounds of boots.
That's right.
So first step is to get an accurate diagnosis. Okay, is it really high blood pressure? Of course, there is a debate going on. Should older people have a blood pressure 120/80? I have concerns about that because sometimes if the blood vessels have become stiff and rigid because they don't have nitric oxide like they used to, they have more stiffness, they have more swelling, their blood vessels are not as responsive or pliable as they used to be. They're not going to get oxygen to the brain. If you drop their blood pressure precipitously, they're not going to get oxygen to the brain. And so my concern is we need to work with the elderly people. We don't want to drop their blood pressure too low. Then they're going to be sitting in a chair. They're going to be tired. They don't feel like doing anything. They kind of have brain fog. They're kind of confused. They just don't want to do anything. And then, of course, the common complaint is fatigue. I just don't have the energy because they're not getting the oxygen to the cell. So sometimes elderly people, it wouldn't be unheard of, to have a higher blood pressure, 140, 150 over 70, because their heart is having to work slightly harder to get through that stiff and rigid.
What are the top three, unless you already said it already and I missed it, but what are the top three for low blood pressure problems?
So low blood pressure is not a big problem unless you faint, right? Mm-hmm. So if you don't have a lot of room, like we live in Texas, it gets hot here. So if your blood pressure is 50, I often see people coming in blood pressure medicines, and if we get an accurate reading on them, it could be literally that low number, the diastolic number could be in the 50s. And that is way too low, okay? They can faint because it's too low. And heaven forbid, what if it drops even more if they take, another blood pressure medicine? So it was interesting because this patient in particular, as she got off the meds, finally that fifth med, and she said, you know what? I said, what? She said, my blood pressure is the same as it was when I started out. She got off all those medicines and her blood pressure was the same, The body is adapting and it's going to try to get what it needs. So it's going to move that blood pressure where it can. But if it's having to work against medications, then it just has to work a lot harder. So what we want to do is open up the blood vessel naturally, make sure, there's plenty of volume in the circulation, and keep the oxygenation good. Make sure you've got enough nitric oxide on board. And I forgot to tell about one of the big benefits of nitric oxide is for erectile dysfunction. A lot of people use sometimes a lozenge.
Why'd you look at me like that?
I knew you were going to say something. I was waiting for it.
I was trying to keep it in.
I know. But it does have to do with tumescence of the penis, and so it's very good for a natural solution for erectile dysfunction. And so...
what would be the application of that?
Just take it by pill. So there are lozenges you can get with nitric oxide. We have a professional line that you can actually track and see how much nitric oxide you have. If you're not making enough, then we supplement it. But yeah, we have several patients using it for erectile dysfunction.
I was comparing everything you're saying. I have a personal situation where I had to have something done. I was at a certain level. I had to have something done to check. Because of a paperwork snafu, they made it seem that I was a certain way. And because of that, it caused all these disruptions to have to fix. That's what reminds me of the medicines.
Yes.
You get misdiagnosed and you're going to go all over the place.
Well, I think all of us experience that on a daily basis. You need to get into your phone really quick, or you need to get into an app, but you got to authenticate first, or then they send the email to the phone, and then you're like, I don't have my phone, and it's a text message. And then, the complexity of our world these days, people get that. But that is exactly, Matt, that is exactly right. The body adapts. It's like, and you have to realize that medications are toxins to the body. So the body says, how do I get rid of this? How do I metabolize this and break it down? That's what's called the half-life of a medicine. How long does it take to get it out of the body? Versus a supplement like magnesium. The body wants magnesium. It has to have magnesium to make ATP, that energy molecule. And so supplements are very different than medications. And so, sometimes because of the world we live in and the food we eat is not what it used to be, we have to take supplements.
Yeah.
So.
Then you got to make sure the supplements are okay.
Yes. That's right. And so we ask people to bring their supplements in because sometimes, like if you're taking calcium, it will deplete your magnesium.
Shelley, is there, for future shows, is there any way that the listener out there can make contact with you with questions?
Well, we're hoping that we're going to have a phone so that people will call in. And once we go live, then we'll have a live show. we'll have people call in and ask their questions, and I'm excited to get to that point. But
you got a great opportunity, ladies and gentlemen, to have access to a fantastic doctor who wants nothing but the best for you, and she'll be available, God willing, every Wednesday on KTCP, and that's 98.7 FM.
That's right. Thank you, Matt. I appreciate it very much.
It's always a pleasure. I mean, you got a couple more minutes here. What else do you want to tell them?
Well, just remember celery, arugula, beetroot. What else? What was the other one? Oh, no.
Well, celery I can pronounce. Beets I can pronounce. That other one, forget about
arugula.
But what was the other one? There was another one.
Oh, man. I better look it up.
Is that high blood pressure? We're getting foggy.
Oh, I know it's in my notes. Help. Well, they'll just have to listen to the beginning of it.
That's right.
Yeah, but celery's a good one.
Speaking of which, you can play this again on Facebook if you want to see it until it broadcasts next Wednesday.
Yeah, and don't use mouthwash. Make sure you have plenty of acid in the stomach, and you're gonna do great. And if you're not sure if you're making nitric oxide, there are test strips. We offer them to people free when they come into the practice and come into the office. So you can always check, to see how much nitric oxide do I naturally have.
Dr. Shelley, a lot of people are getting turned on to you who have never heard about you before. But since we have a couple minutes, literally, why don't you explain who you are and your history and where you got to this point, if you can do that in a relatively quick way.
Well, I went into private practice about 29 years ago, and so I made a kind of a conscious decision not to take insurance, and it allowed me to spend more time with patients and to really have, a deep relationship with that patient. And so it was just a journey to figure out what was going to be the treatment that would work the best. And you know what happened?
What?
I realized natural things work a lot better than unnatural things. Yeah. And they have a whole lot less side effects.
But we will add on, we said this before, let me say it again right now, but because we're not in 1950s and we're here and we're dealing with the natural foods that are contaminated with all these chemicals, we have to work even harder.
Yes.
In addition to not.
That's right. That's right. I mean, back in 1950, they would eat a wonderful meal. They'd have a dessert. They didn't have structured exercise. I mean, okay, get up, man. Go get on the.
What do you mean? I've been working all day. I've been doing physical labor. I've been doing back in the night. Everybody's just sitting there, pushing their thumbs on a keypad.
That's right. We don't get out in the sun. We don't do our exercise. And so we have to do some of these crazy things like a red light panel, which seems like, are you kidding? Because we do have so many toxins in our environment that are contaminating our bodies and making it less likely to make energy in our bodies. So if we can get the toxins out, and nitric oxide also helps us make more of those energy organelles, the mitochondria. So that's super, super, super important. So if you have high blood pressure, you need to know about nitric oxide, and you want to ask your doctor about natural remedies. Magnesium is wonderful. I believe salt is a superfood. It's not a danger. Now, of course, the refined salts that remove the 84 minerals and then put the iodine back in are a concern. But when you eat a natural salt with the 84 minerals in it, that is so healthy and good for you. So salt is a superfood. We'll talk about that another time.
Shelley, let the people know your website, your phone number, and once again.
So we're at healthysuccessworks.com, and our phone number here in Temple is 254-773-4900. And if you want to get a red light panel, we have a coupon on the website. Just go down to the near the bottom of the website. You'll see some of the things I like the kind of grass-fed, grass-finished beef we like, and the red light panels and so forth. We'd love for you to go to the website.
Very good. Shelley, well, it's very exciting. Your first show. And there's going to be many more to come, I'm sure.
Well, thank you, Matt, and thanks for being with me. I sure
pleasure
appreciate it.
and honor to serve. It's a pleasure and honor to serve. What's your mine's always, until next time, God bless, keep your powder dry. Do you have a quote at the end of the show you want to start incorporating?
Well, let's see. Let's stomp out some ignorance.
All right. Sounds good. It's good to see y'all. Until next time.